On your back for a moment. So this is where we can sometimes have a little bit more fun. Obviously, your classic simple rotation here, there. Okay. Interestingly, do you agree that in supine this feels very different? This feels fine, and then there's a restriction here. Okay, so different positions show different things. Okay, passive and active sometimes will show different things. This, if I was to call it a problem, this is the actual problem. Would you agree with that compared to what we were doing in seated? Okay, there you go. So your tests don't always line up. Okay, so I've got this, right? I can just hold this. I can have him here. So that this is currently head and neck in relation to a still torso. But now, put your right hand on your left shoulder. Okay. I can do this, right? So this is the chin getting further away from the left shoulder. This is the chin getting closer to the left shoulder. Further away, closer. So I can use the opposite side. I can pull this, right? Or I can go the other way. So that's, while I'm going direct, I'm able to use the torso. Okay, put the left hand on the right shoulder. Okay, so now I can do this, right? So this is the shoulder getting closer to the chin, the left shoulder getting closer to the chin. I don't have any other activating forces here. It's not going to work all that well. I've got really good torsion or really good rotation. If I wanted to get the other activating forces, a hold like this will do a decent amount. So I've got monitoring on the bottom side of the neck with my left hand under the circumstances. If I move my hand slightly differently, I can monitor more or get further around the neck. I can compress, I can distract, the torsion's already there, and I can create a little bit of side bending. So that feels like your head is turning more to the left and it's comfortable. Is that fair? Okay, so it's tiny. The distraction builds tension into my hand. It doesn't really do much. The compression softens it up, and then there's a little bit of side bending. You can see it in the ear or in the chin. See it in the ear or the chin, and there you go. Right? So that's checking the different compression, distraction, torsion, and shear. The torsion's already there because it's rotation. The shear essentially is light side bending. You don't actually shear. You just create movement in the coronal plane, and then the compression worked better. Right? Top hand. The top hand is coming down, and the bottom hand can come up. Right? So it's off neutral. So an AP or PA force in the midline is generally flexion extension. An AP PA force off midline is generally rotation. Right? But then when you have them in a non-neutral position, flexion extension, especially in a rotated position, flexion extension kind of becomes side bending. It's not always the case, but it's something there. To answer the specific question, if you watch the hand, my top hand will come down and my bottom hand will push up. Excuse me. That sucks. Right? There you go. Okay. Come back.
I want to say that the distraction felt the best, but you would
It felt
say
the best.
It felt the best for me as a patient, but you're basing it on what you're feeling.
Yes, I'm basing it on what I'm feeling because unfortunately I can't feel what you're feeling.
Right.
And I got something tickling my damn neck. Okay, prone. I don't really need to show you. Please don't do it. Prone is really good for active. Prone is really good for patient active rotation. It actually works pretty well.